Health Services Health Talks. I'm Dr. Joshua Delito, a family physician. I have interest in public health, cancer care, and also cancer prevention. In this video, we are going to look at some of the way that we can navigate health challenges as a family. It is important as a family that we strengthen the family bonds, and this will help us in coping with the challenging health issues that might affect family members. Usually diseases have big impact on the unity of the family, the financial status of the family, and so it is important that we are ready and we stay well organized so that we can be able to have a way of coping with some of the health challenges that we can face as a family. So what are some of the family challenges that you may face? One is chronic diseases. If a family member gets one of the chronic diseases like diabetes, cancer, hypertension, so how do we cope with this as a family? How does it affect the family? Mental health issues like stress, depression, and even dementia. Then you have infectious diseases and epidemics, which can happen. Financial burdens of healthcare. How well are we prepared financially for some of these challenges that can be sometimes catastrophic? Then lifestyle and behavioral health challenges. Remember what we eat as a family. So if you are eating wrongly, we are likely that you see a whole family with obesity. Then the issue of smoking among family members. If one parent is smoking, then the other family members become passive smokers. Then the issues of addiction, which can affect family members, parents, and they can also affect the children also. Then what are some of the impacts of these medical or health problems to the family members? There's the emotional and the psychological impact. This can lead to stress, anxiety. There is the fear of the unknown when one of the family members is sick, and there is also impact on relationships because if you take, for example, a family member with diabetes, then he has a specific diet restriction that he tends to have. Then the other family members, they have to find a way of fitting in so that they can help him fit into the diet plan and also live healthy. And then the issue of coping mechanism. When one of the family members is affected by as an illness, the other family members, how do you cope up with this without getting overwhelmed? Open communication is very important. So it is important that you have honest discussions and create space for sharing concerns. So what are some of the worries that you have? What are the sick people concerns? And also involve the children in an age-appropriate manner so that they are able to cope up with this, they are able to help where they can, and they also understand and they will be able to cope up with what is happening. And then setting collective family goals as a family. So the role of family support. This emotional encouragement when all the family members are involved, helping with the practical assistance in daily care. They can help the person who is unwell keep his appointment, scheduling and assisting with his work or his course when the family member is going for his health checkups. That is, they can also accompany the loved ones for the medical visits, helping them to remember some of the things that they might want to share with the doctor at the medical visit, and also helping them write some of the concerns that the family might be having, so that when you go to the healthcare provider, you have adequate time and you can also share this. I have seen it in my own practice where someone comes with a family member, and sometimes they cannot forget. For persons with dementia, the family members are bringing them to the healthcare visit. They help them remember and also help them with some of the challenges that they are going through. And also this helps also in family education and also helping the family to understand what is going on, and then they are able to start together, thus creating a strong support system for the person who is unwell, and this helps to cope. Then there is the issue of financial struggles due to illness. health insurance and the emergency funds are very necessary. So as families, we need to think about this. Do we have a reliable insurance scheme? Can we supplement what we have so that in case of a serious illness, then the burden of finances does not overwhelm us. Then budgeting for medical expenses. Remember that there is expenses going for the medical checkup, going for the treatment, the test. All these need finances. So it's important that we budget for some of these expenses, and then seeking community and government support. As a society, we need to have a health scheme that we are all contributing to, which helps us that all of us, as a society, we take care of the sick ones in our society. And this calls for thinking very through the health insurance schemes that we have. And we should have insurance schemes that try as much as possible cover everyone, and especially the most vulnerable in the society. How are we taking care of the elderly, the young ones, in the health insurance schemes that we have? And how also are the medical facility supported by the health insurances that we have? Then exploring the need for telemedicine and the need for cost-effective care, so that we are not overwhelmed by the costs. Then how do we as a family live a healthy lifestyle? One, it is important we look at things like nutrition, having healthy meals as a family, and planning meals together, and making the family members participate together helps very much. Physical activities, you can do sports like football, you can do athletics, you can do cycling, you can also play games like basketball or badminton, or you can even walk as a family when you are going for going to the church, or going for particular common social functions. Then managing stress and the mindfulness together, and then prioritizing sleep and rest. Remember, all the family members can help this, so that each family member is having adequate time for sleep. Then, of course, the other thing that is very important as a family and helps in healing is having a common faith and the common spiritual practices. Faith helps to cope with illness. It also helps find strength in prayer and community, and they also supporting one another in spiritual matters. Then there is also the issue of navigating the end of life decisions. When there is a family member who has advanced either chronic disease or any of the life-threatening conditions, we have advanced care planning, hospice and the palliative care decisions, emotional and the spiritual preparations, and then family legacy and the family values. So it is important that we realize that illness will always come in our families, and we have to find ways. Of course, we have to be proactive, trying to live as healthy as possible through exercise, through healthy diet, but building strong family bonds fosters better health outcomes. Communication, faith, and the proactive care are very essential, and every challenge can be an opportunity for growth. Remember that challenges will always come, but the good news is also that with these challenges, you also learn, and you also get new skills. And remember, this helps you to become a better person every day. So it is important we encourage discussions in your family about health issues. Prioritize preventive care and lifestyle changes, so that as a family, if you embrace good health practices, then as a family we live healthy. If you practice bad healthy practices, we get sick as a family. So then being there for one another. So let's share some of the family practices that we are doing, so that we can be able to prevent diseases together. Remember to share, subscribe, and also follow us on our social media platform like LinkedIn, Instagram, and also Facebook. Thank you for watching.